Introduce our next speaker, who is Sherri Isaak. She's also from the Department of Public Health, Nutrition, and Wellness. She is the director of our dietetic internship. She is a registered dietitian, and she is a diabetes educator. So that's her specialty area, and she's done a lot with diabetic patients. And something kind of fun and unique, she just recently was recognized as a change champion from the American Association of Diabetes Educators. So she's done a lot in this area, and she's going to talk to us today about some of the basics of diabetes. So let's welcome Sherri.
Thank you. All right, well, I have been a certified diabetes educator for about 20 years, and I've heard a lot of myths about diabetes. So we're going to go through some of those today. Seem to be working. Okay, we're also going to talk about signs of misinformation, as well as some really great resources on diabetes, how you can get some more information. All right, so let's go ahead and go through some of these myths and truths. All right, so the first one, do you think this is a myth or a truth? 1.2 million people have diabetes and don't know it. What do you think? Myth or truth? Truth? Okay. That's actually a myth. It's actually 7.2. All right, 7.2 million are undiagnosed with diabetes. Right. So 23.1 million have been diagnosed, and 30.3 million have diabetes. That's a lot of people, right? Why are we concerned about that? You know, a quarter of all emergency room visits are diabetes or diabetes related. That's a lot of ER visits, and that's a lot of money. That's a big cost. And diabetes, there's risk for diabetes complications. If you look at amputations, diabetes is the number one cause of amputations. And diabetes can also increase your risk for cardiac disease, kidney disease, and neuropathy. There's a lot of complications that are related to diabetes that we're concerned about. But there's things you can do to control that, right? And we're going to talk a little bit about that today. So, how do you know if you have diabetes or if you're at risk for diabetes? Well, the best thing to do is to talk to your healthcare provider, get a blood test, get a fasting blood glucose, have your A1C done, which is a 2-3 month average blood sugar. But there are things that you could do today or even this weekend. You can get on diabetes.org and take this risk test. You just go to diabetes.org and type in risk test, and it talks about things, are you at risk for diabetes? There's a lot of risk factors as far as there's some genetics, there's weight, there's family, talked about family history, 45 years and older, there's a few things. But you can actually just get on this website and find out if you're at risk for diabetes or not, besides getting a blood test with your physician. Okay, another myth or truth. I'm destined to get diabetes, it's in my genes. That's a myth, right? Of course. All right. It's a myth. You can actually prevent diabetes. One of my absolute favorite trials is the Diabetes Prevention Program. And that showed that lifestyle intervention can reduce your risk of diabetes by 58%. That is huge. And most amazing to know is that it was 71% in those 60 years and older. That's huge numbers. And if we compare that to the medication arm of that study, the medication arm was only 31%, right? So the lifestyle arm won out, which is really exciting for me. Okay. So what did these people do? Well, in the lifestyle arm, they exercised 30 minutes, 5 days a week, and they also lost 5 to 7% of their body weight. All right? A lot of patients worked with in the past, they were like, well, I have to lose 50 pounds to make a difference, and my blood sugar levels. No, it's only 5 to 7% of body weight. All right? And there's a lot of other things that you can do to help reduce your risk of diabetes. There's lots of studies to show that green leafy vegetables and nuts and beans can all make a difference in reducing your risk of diabetes. So I really liked what you were saying today, because my new motto is greens, beans, and grains, right? So greens, beans, and whole grains can make a difference in reducing your risk of diabetes. All right, so if we take a look at greens, what are some greens? Kale. Okay, kale. What else? Spinach, collard greens, mustard greens. There's a lot of different ones. All right, who is anybody in here who never had kale? Come on, there's got to be a couple people that have not had kale. Really, everybody? Well, I'm really impressed. This is an amazing group. So I have a couple of friends, and one's a psychotherapist, and one is a physician, and they said, I do not like kale. And I said, really, have you tried it? Guess what their answer is? No. Okay, all right. Well, I was really expecting there to be somebody that had admitted today that they haven't had kale, because I've got some free kale here. All right. So I'm just going to pass it out randomly today. You haven't had it. Okay, well, good. Here you go. And here's a recipe. All right. Anybody else want to admit it? Okay. All right, back here. So just like Evelyn's saying, this is great. It's pre-washed, ready to go. I've got a couple recipes there for you, too. All right, you're very welcome. All right, so there's no excuse for you not to get your greens today. We had it for lunch, and now you can have some for dinner. All right, here's another one. Eating sugar causes diabetes. Yes, no. Okay. Yes, no, maybe so. All right, yes, no, maybe so, pretty much, right. So sugary drinks have been linked to type 2 diabetes. And in the last couple of years, the American Diabetes Association has recommended that people avoid sugar-sweetened beverages for those, with diabetes or pre-diabetes. And generally, I do not like to use the word avoid, and I actually had limit on the slide, but then I went back to the reference, and they said avoid. All right? So that's what the American Diabetes Association recommends. Now we know it's not realistic for us to completely avoid things all the time, but that's their stance on it, to try to really limit it as much as possible. And if we think about reasons why, because the studies are showing that there's a link. But like the Nurses Health Study 2, showed that those people in the study that had one sugary drink a day had an 80% increased risk of diabetes. That's a huge difference. Even one sugary beverage a day. So we're going to take a look at some beverages right now and see how much sugar they have in them. So I need some volunteers. Anybody want to volunteer? Okay, I need about 7 people to come on up here and help me. All right, so I just want each of you to take a beverage, and I want you to line up as far as the amount of sugar you think this one container has. All right, an amount of lowest. We'll start lowest over here. No, you can't read the label. I already blacked them out. Don't try to read it. Okay. All right, I need one more volunteer. One more. Okay, you. That'd be great. All right. So lowest over here, lowest amount of sugar. And you know what? We're going to go with just this one portion. We're not going to look whatever the serving size is for that bottle. Okay? Some of them have 2, not very many of them, only the coconut water, but we're just going to say you're going to drink that whole can because not very many people drink half a can, right? So we're going to start lowest over here, all right, lowest amount of sugar here, and highest here. So I'll give you guys a couple of minutes, all right, lowest, highest. So what I want you guys to do is I want you to just kind of write it down on a piece of paper, what you think, because you might need to help them in a couple of minutes, all right? So lowest amount of sugar, the highest. So what do we have here, just to be sure? So we have very vanilla soy milk. We've got LaCroix. We have Orange Crush. This is Starbucks hot chocolate. All right. We have vitamin water, coconut water, and Snapple. That's what those are. Okay, lowest to highest. All right. Okay, don't look at the food label. I blocked out the sugar, but I didn't block out anything else, all right? All right, I did block out the sugar. Okay, so you guys, so who are we here? This is what they think. You want to help them out at all? We've got coconut water, LaCroix, vitamin water, very vanilla, the Snapple, the Starbucks hot chocolate, and the Orange Crush. You guys think they're right? We can make one swap. Not you. You can't say because you're a professor. All right. The LaCroix is all right. That's their one swap then. All right. Well, let's take a look. So guess what? You were right. That was a smart swap. Good. I'm glad I chose you, right? All right, so we have LaCroix. Oh, no. Okay, yes, good. All right, very vanilla soy milk. Vitamin water. Move her over here. Okay. Starbucks. All right. Coconut, right? Next. Then the Snapple, and then the Orange Crush. All right, so hang on. What I want you guys each to do is then to pull this out. Here, your Orange Crush, so go ahead and open it up. All right, so we're going to put this into context here. And we're going to show you how much sugar that actually has. There you go. Okay, and all right, here, Professor Krivak, help me pass these out. You guys want to stay here all day? All right, coconut water, Starbucks hot chocolate. All right. Okay, this is nothing because this is just like a sparkling flavored beverage, right? So hold it up so everybody can see. All right, very good. So this just kind of puts a visual for you. These are packets of sugar. Each one has 4 grams, right? So you can kind of see. Now, one thing I want to show you is that the silk soy milk, this is only an 8-ounce portion, so that's pretty small. But we just did it on per container because that's what we know what people drink. So thank you so much. Give the volunteers a hand. Great job, guys. You actually can have this if you want. I'm giving the LaCroix away, nothing else, because they're a little high in sugar. All right, so the point is, it's really important to take a look at your food labels and see where you're at with the sugar content. It's pretty surprising. And, trying to choose a lower sugar beverage is a good idea. Like the infused waters we had today, those are fantastic. Some of the sparkling flavored beverages that have pretty much nothing in those are great too. Okay, myth or truth? This is one we hear a lot. So there's a lot of diabetes-type foods out there, sugar-free cookies, sugar-free candy, sugar-free chocolate. It's important to eat sugar-free foods to manage your diabetes. What do you think? Myth? You think it's a myth? Okay. All right, you're right. So sugar-free foods may not have less calories, they might not have less carbohydrates in them, right? You really just need to take a look at that food label. All right. So if you haven't read food labels before, and I know some of you have because you are in some of our classes, but you want to always look at the serving size. You can work with a diabetes educator on how much total carbohydrate. There's going to be a very new food label that's coming out. The great news is it's going to have new information on added sugars, right? So you'll know the difference between how much is natural sugar in there, like with fruit, and how much is actually added sugar. So that's going to come out in 2020 or 2021. It depends on how much money the food manufacturer grosses a year based on when they have to comply with those guidelines. All right. But always taking a look at that food label. Its bottom line is it's really looking at that total carbohydrate. Good idea to look at the added sugars too. The other thing, we got a lot of, using added sugar, artificial sweeteners is a very personal choice, right? So I have a lot of patients that will come and just say, I don't feel comfortable using those. And I say, then don't. That's okay. It's really up to you. But they are, have been regulated and approved by the FDA, and there are maximum amounts that it can have. So this is the acceptable daily limit, really. So acceptable daily intake of sweeteners. So this is the amount that you could consume on a daily basis over your lifetime, right, without having detrimental effects. So I'm not going to go into this specifically, but just so you know, for example, and this is based on your weight, so like a 150-pound person wouldn't want to consume more than this on a daily basis. If they did, then there could be some detrimental effects. So if we take a look like at the pink packet, they wouldn't want to consume more than 9 to 10 packs of that a day. And I've had patients in here to my classes or clinic or as a diabetes educator, and they've said, I have 3 or 4 cups of coffee a day or tea, and they're using, several packets in each cup of coffee. So it is important to know that acceptable daily limit. And that is available on the American Association Diabetes Educator website, and I list that at the very end, as well as on my professional Facebook, which I'll give that to you also. Okay, So low carb trend, right? It's been going on for a really long time, really popular. There's a lot of diets that are really popular to help manage diabetes. This one is low carb diets are the best way to manage your blood sugar. Boy, what do you think? Let's see. What is diabetes? Diabetes is when there's too much sugar in the blood, and we know that the protein, carbohydrate, and fat. Carbohydrate is the macronutrient that does increase our glucose levels the most. So what do you think? Do you think this is a myth or truth? It's a myth. Okay. Karen says it's a myth. All right. She's a dietetic student. Anybody else? All right. So really it is a myth. All right. So improvements in blood sugars are short-term. This is straight from the American Diabetes Association. So what they're saying is that improvements in blood sugars are not maintained long-term on low-carb diets, all right? So there is a short-term, you'll see short-term, right? But long-term, we're not finding that. All right. And there are a lot of types of eating patterns that can be used to manage diabetes. It's not just carbohydrate counting. You know, for a long time, we used to just have patients do carbohydrate counting, but there's so many other diets that have been proven to help manage your diabetes. Vegetarian plant-based diets, a lot of research towards that. Carbohydrate counting, that's one, that'll work. DASH diet, what is that, Karen or Nicole? Does anybody know? Dietary approaches to stop hypertension. Thank you, very good, on the spur of the moment there. So that is a very well-known diet that has lots of fruits and vegetables, whole grains, beans, it limits sweets, and that has been shown to help like almost everything, it seems like. But really, there's been research on diabetes too, and diabetes prevention. All right, the Mediterranean diet, all right, can be beneficial for diabetes also. Intuitive eating, there's research on that too. So intuitive eating is when you're paying attention to your hunger, cues of hunger and fullness, right? How hungry you are before your meal, check yourself halfway in between, and afterwards, you know, how full are you? I love to use that with patients because it's their own body's way of telling them how much food they need, right? Rather than following a specific diet. So that's one of the things that I'll work with patients very closely on, is helping them with the intuitive eating. And also looking at your triggers to eating, because we know there's a lot of emotional eating that, you know, goes on. We don't eat just because we're hungry, right? So intuitive eating is one of my favorite ways to help people manage their diabetes too. Okay. All right, so like I said, those are the myths and truths that I wanted to cover today. There are so many more myths and truths that I've heard as a diabetes educator, but these are really key ones that I think are important for you to be aware of. All right, and then also when I'm working with patients, I want them to be aware of some inaccurate information, like what do you pick up on? What do you look for? So a list of foods that are good or bad, right? That's one thing to take a look for. A promise to cure your diabetes, right? That's something that they'll hear a lot is that, you know, not necessarily curing your diabetes. That special diet might not necessarily do that. It can help manage or control your diabetes, right? Unknown websites, we're really looking for .gov or .org websites are generally the best. Claims that sound too good to be true. That's one thing, again, we want to really work with our patients and help them understand that if it sounds too good to be true, it usually is. And then recommendations based on a single study. You'll hear a specific study, a news report, maybe they'll read it in a magazine, a Reader's Digest, and we really don't want to look at a single study specifically. And then recommendations that are a quick fix for your diabetes. So again, something that's just quick and not a long-term lifestyle change is something we want to avoid also. All right, sources of reliable information. So these are some of my favorite websites to help people with diabetes, diabetes.org, the American Diabetes Association. American Association of Diabetes Educators has a fantastic website. The one that I showed on the AAD tip sheet on the acceptable daily limits of sweeteners, that's something that I got from the American Association of Diabetes Educators. Eatright.org, of course, those of us that are nutrition professionals, we belong to Academy of Nutrition and Dietetics. That's another really great, reliable website. Joslin, very well-known diabetes center, and the National Institute of Diabetes and Digestive and Kidney Disease, excellent resources there to help patients manage their diabetes too. Okay. One thing I always like to ask my patients, or anytime I'm doing a talk on diabetes, is what is one thing that you can do to help prevent diabetes? And it might be, being active. And in fact, I wanted to mention too that the American Diabetes Association actually put in their new standards that they want people with diabetes to move or get up every 30 minutes, right? So I'm so glad that we're doing that today, but they're specifically put it in their standards of care, and their 2018, also in their 2017 standards of care. People with diabetes need to move every 30 minutes. All right. So maybe that's something that you could do, get up and bust a move like we've been doing today. Maybe it's the greens, beans, and grains, or whole grains, that Evelyn was talking about earlier today. Maybe it's just getting tested for diabetes, right? So try to think of one thing that you could do to help manage or prevent diabetes. Okay, there are my references. And if you want to connect with me, there is my email address. I do have a professional Facebook page as well as Twitter. I'm happy to answer any questions that you guys have, not now on the panel, but also via Facebook or Twitter also. All right. Thank you so much.